My name is Richard August, and I'll be your host. Our guests are Diane Santos, the chairwoman of the Senior Agenda Coalition of Rhode Island, and Maureen Maigret, who is the policy advisor to the group. Ladies, welcome to State of the State.
Thank you.
Thank you,
It's nice to
Richard.
be here.
Very nice.
I think it'd be good for people to become familiar with your group, which we're going to refer to as the Senior Agenda instead of that big long name, okay? So, Diane, can you tell us about the group itself? What's the goal? And I know you've been around since 2002.
That's right. All right, I'll give you a little bit of history and tell you who we are and what we do, okay?
Absolutely. Yep.
Yeah, we were actually part of the Gray Panthers of Rhode Island in 2002. But in 2008, we broke away and we became an independent entity, nonprofit, okay? We're actually a coalition of independent and diverse agencies and individual members, okay? And the mission has stayed the same for all these years, okay? Our mission is to motivate people to implement an agenda to help older Rhode Islanders and adults with disabilities to have a better life. And we do that in 4 ways. The first way is community organization. The second way is public education. The third way is advocacy, and the fourth way is legislative action. Mm-hmm. So we've grown over the years, and this is really an exciting year for us in many different ways. Okay, we were without an executive director for about 6 months, but we've just hired a new one, and we're very pleased. Her name is Carol Ann Costa, and she's retired from the Attorney General's office. She was a constituent in constituency there, mm-hmm. and she has a lot of experience in other ways. And most important, she has a passion for helping people, and that's what we're all about, mm-hmm. okay? So we look forward to working with her. We put on 2 conferences a year as part of our public education. The first one is usually held in March. It's a leadership forum, a legislative leadership forum, and we invite the Speaker of the House and the President of the Senate to attend. And usually, Maureen, we determine our priorities for that legislative year, and we present them to the Speaker and to the President. And then we have members of the community come and speak to those priorities, tell them what the experiences are of the elderly, of the older adults, and the people with disabilities. And then they usually come up, the Speaker will get up, and the President will come up and respond to us. So this last legislative forum that we had over 275 people.
Now we're going to talk about that a little bit more, but I want to keep focusing on you and on the organization. How long have you been the chairperson?
Okay, well,
chairwoman.
Okay, well, I've been with the organization since 2020, but I've been acting chair became acting chair in October 2023, and then full chair at the annual meeting in December of 2023. Okay. So not too long, but we've done a lot in that period of time. Yep. Yeah, we've addressed a lot of the internal policies that hadn't been looked at for a while. We revised the bylaws. We're in the process now of revising our strategic plan. That ends in 2024, so we're writing a new one. We are enlarging the board. We're getting new board members on. We have a new executive director. We have a new assistant to an executive director. We're doing more outreach. So we're on the precipice of growing. Excuse me. So
do you have dues, or what's the source of funding? I mean, are you paying these people? Are they all volunteers, or do you have a source of funding?
The executive director and the assistant to the executive and Maureen are salaried, okay, or they're paid. The rest of us are all volunteer, mm-hmm. so everybody on the board, and it's a very active board. Right now we have 11, and We're having a meeting tomorrow. 2 more will be coming on board, so that's 13. But that's all volunteer. Our funding comes mainly from grants. I would say probably about 98% of our funding comes from grants. The rest comes from membership fees and donations. But our membership fees are very reasonable. I mean, if you're a student or if you're on a fixed income, it's only $15 a year. Then it goes to $25, $35, and so on.
Okay. And your background really was, you came out of the human resources field, and I know you've done lecturing for various nonprofits, including, I guess, the initial homeowners program the Rhode Island Housing had?
Yeah, actually, I've worked for and with nonprofits my whole career. I worked for Rhode Island Credit Union for over 20 years, and I was administrative there. I worked for the Board of Directors, Supervisory Committee, and Executive Staff. But I also had human resource responsibilities for the union portion of the employees. I also worked for Consumer Credit Counseling Service, which later became Money Management International. So I started off there as a credit counselor. For 8 years I did that, and then I transitioned over to education, where I went out and I went to various nonprofits, CAP agencies, housing agencies in Rhode Island and Massachusetts. And I gave presentations mostly on budgeting and credit. And then I also worked with Rhode Island Housing with their first-time home buyer program.
Maureen, your background is a little different. You are, I believe, a registered nurse, and you served 5, let's see, we do some research too, 5 terms as a state legislator, and you ran the Rhode Island Department of Elderly Affairs.
Yes.
You're a registered nurse and a former 5-term legislator, and the former director as the Rhode Island Department of what was known as Elderly Affairs. But what is your role at the senior agenda? What do you really do as policy advisor? What does that mean?
Well, I've been working either on a paid basis or a volunteer basis for the senior agenda for many years, probably going back to 2010, working with former board chairs and really advising about policy relative to aging, long-term care, because of my background in aging services. In addition to serving as the director of the Department of Elderly Affairs, I've worked for several lieutenant governors as policy director. I've been manager of the State Long-Term Care Coordinating Council, plus my background in nursing. As you know, probably 60% of health care is for older adults. So as a person who worked both in the hospitals and in community, I certainly was aware of the health care issues relating to older adults. So it was kind of natural for me to work as a policy consultant to them, and more recently, the title is policy advisor. So it's a passion I have for our older population. It's a population that's growing, as we all know. Some people call it a tsunami, but I don't really like that. I think that's a very negative term. I like to, when I talk to legislators or when we're at one of our conferences, I always like to start off with information about older adults. And I particularly like to talk about what they contribute to our community, not just the fact that they represent right now 20% of our population, soon to be probably 25% in probably 6 or so years. But I talk about their contributions, not only in the past, but the fact that 21% are still in the workforce. Our older population pays taxes. They contribute immensely to the society as volunteers. One report shows that not just for older adults, but they make up a significant portion of volunteers. And volunteers in Rhode Island have been demonstrated to be the value of $2.1 billion if we looked at it. And we have something like 120,000 volunteers in the state of Rhode Island, which is really important that people know about the contributions. The other thing I like to point out is that we vote in big numbers. When we look at the age groups and the voting history, older adults really vote. But that doesn't necessarily translate to political advocacy, and that's one of the things that the senior agenda really tries to focus on, is encouraging and motivating older adults to become active, to really speak up for themselves on issues that are important to them. The other thing I like to point out is the enormous amount of money we bring into the state in Social Security. It's something like a little over $3 billion, which is a used economic factor for the state of Rhode Island. So those are some of the things that I like to talk about. And then I like to talk about another passion that I've had throughout the years is really looking at the issues related to women. And now that I am an older woman, and the fact that older women outnumber men.
Oh, I was going to get to that.
You were going to get to that.
Yes.
So, you know, that's really important. Even 65 and older, I think the ratio is something like 56% women. But as we get into the upper years, particularly 85 and older, it's something like 70%. And I think that's really important that the people who make policy understand that.
Yes.
For many reasons. One of is that women tend to have much lower wealth than older men. You know, so those are just some of the things that
No, you're
I
anticipating
think
some
about.
of my questions anyway, so by all means, keep going. I know we were talking about that event in March, was at the Crown Plaza in Warwick, and it got a lot of publicity. As you said, the Speaker of the House and the President of the Senate both attended. And there were policy objectives, if you will, that were outlined. And one of them clearly is what you call the graying of the population,
Right.
which you're talking about. And women, I guess, represent, they call them the golden years. I guess, to me, the age 65 is when we stop being middle-aged and we switch over to senior citizens. I don't know. It seems to me that a lot of, as you said, a lot of people that hit 65 are still working.
Right.
And by choice sometimes, and sometimes by necessity.
Yes.
And that's an important thing for people to, when I say people, legislators
Right.
especially, to understand.
Right.
I mean, I think they certainly understand that senior citizens are a voting bloc that votes. And, you know, as
We
you
like
said.
to let them know that.
Yes. Well, I think a lot of them do. But you're right. I think you, at one point, you pointed out 2 out of 3 residents in nursing homes are women.
Yes, about 70, right now it's about 70%
Even more, yeah.
of nursing home residents are female, based on data from the state. And I think if you go to most senior programs, whether it's a senior center, if you're looking at assisted living facility, you're going to see more women than men, just because we tend to live longer. And also, we know that more women in their older years are living alone. And that has profound impact on society, particularly if their family members no longer live close. And it really leads to what some of our themes are. Our themes at the conference really covered 4 particular areas. One was
Well, we're going to get the other 3.
We're going to get,
yeah.
so we can get to those, but it's really important that legislators understand the profile of Rhode Island older adults as they're thinking about legislation and policy issues.
Yeah, I think you pointed out in the meeting or in comments about it that Social Security benefits for women are a little over $20,000 compared to a little over $25,000 for
Right.
men. And I think you attributed this to, and I'm quoting, women leaving their jobs over the years to raise their family. And I think for those of us of our generation that this is probably the case. But I'm going to ask you a question. Is this still the case? Because increasingly I see women today want a career and a family. And so increasingly I see young women having a baby or 2, and then they turn to their mother and ask them to raise their kids so they can get back in the workforce. And in some cases, women end up earning more than men now. I mean, we're talking about looking at the future, but your point about the present is probably correct. But aren't we heading in a slightly different direction in terms of women's compensation?
I certainly think we've narrowed that wage gap considerably, but it's not entirely closed. And I just saw some data this week that showed while women have been doing better, when we look at the very top level of management and high-level companies, we don't have equity yet in terms of women. And this was data that was national data.
When you say we don't have equity, are you saying that women, in terms of the balance?
In terms of the balance at those very highest levels.
Yep.
And I think, I haven't done any research, but I think there would be research out there that there's still disparities in general wages when we look at some professional careers for women. But yes, we have made a lot of progress in narrowing that wage gap. I'm trying to think when I first started to look at issues relating to women was way back when I was in the legislature in the mid-'70s and early '80s. And I think at that time was maybe 59 cents per every dollar. And we've certainly come far beyond that now. But we still have ways to go. And women still bear the brunt of childcare in this country. Although, you know, when I look at my own family, I am so pleased that one of my children does have their own children, and I'm so pleased that I see that young man, no longer young man, but taking such responsibility for the children. You know, they just pitch right in these days. Very different when I was a young mother.
Yep.
Yes.
Now, the comment that you made, I'll kind of go back to that comment about women's pay, 59 cents for, you know, whatever it is. The problem I have with that, frankly, is if I look at professions that, like teaching, for example, especially unionized professions, where women are represented and probably the majority, I don't believe that women are being paid that much less if you look at comparable jobs. But it's very obvious that a lot of women go into professions or jobs that are more in the service orientation, and that means, you know, they're probably not making as much as someone who's, let's take an engineer, or a female airline pilot, for example, is going to make exactly the same as a male counterpart based on the amount of experience they have. I mean, so there are jobs where the pay is at parity or equal.
There are jobs where we have parity or equity or comparable pay, but there are still jobs that are really undervalued when it comes to what is really thought of as women's work. And I'll give you an example.
Yeah, please.
And this goes back, when I was in the legislature, I was very concerned about the issue of the wage gap and pay equity for women. And so I chaired a study commission that looked at comparable worth in the state system. And what we found at the time was we looked at 10 what we called female-dominated jobs and 10 male-dominated jobs. And working with researchers at the University of Rhode Island, we compared those based upon skills required. And we found really that there were a number of jobs where the skill level was thought to be the same, but the male-dominated job was making more money. For example, it might have been a janitorial job. We found that at that time, nurses really needed to be boosted up. And so based on that study, a number of job positions were elevated that were female-dominated jobs. And then today, when we look at the workforce, one of the concerns that the senior agenda has had has been workforce issues related to the healthcare field, and particularly the fact that as the senior agenda has really been promoting home and community-based care, because we know that the vast majority of older people, if it's possible and safe, would like to get care at home if they need supports. And we find that when we look at areas like home health aides, certified nursing assistants, those wages really aren't what they should be. When we look at another group of caretakers like child care workers, their wages probably should be increased as well. So those typically are very female-dominated jobs. And so the senior agenda has really been, and that's one of the issues that we've been working very hard on, to address wages and provider rates paid by the government for some of these services that help people stay at home, example, home care. And we had a great success this year in that. I don't know if you want to talk about that at some point, but we had been trying very hard to really balance out how we pay for long-term care. And we looked at how much money goes into nursing home, nursing facility care, and how much money is going into home and community-based services. And so way back in about 2010, we got the state to set a goal that we would like it to be 50-50. And we've advanced somewhat since then, but certainly not to the level we would like it to be.
50% of the people would be able to stay, or 50% of the money would be used for home health care?
Right,
as
because
opposed to,
at the time we started, it was way like 20-something%. And so we've increased that over the years. But one of the things that happened in the last couple of years, and part of it was a result of the pandemic, we found significant wait list for people who wanted to get home care, who were on state-subsidized services. In fact, something like 71% of referrals, those individuals are waiting 2 months or longer to get care. And part of the problem was that the provider rates paid to certain services in the Medicaid program were really not what they should have been. So the senior agenda, along with other types of organizations, worked very hard 2 years ago, extremely hard, to get the legislature to sanction a rate review of certain provider rates under the Medicaid program. Astonishingly, the General Assembly heard this, and they allocated something like $1 million to do a study. And they
always have a study.
No, this is a remarkable thing that happened. They funded the study, and they did some very specific detail in the budget saying what the study should look at. And they charged the Office of the Health Insurance Commissioner with conducting the study and using a consultant. And they used Millman, a nationally reputable consultant, to do the study. And they did that study in a compressed time frame that was outlined in the law. In 7 months, they had done this study. And the study came out saying that certain of the provider rates should be increased. And they looked at home and community service rates. And that was one of the biggest increases that they said needed to be done. So the Office of Health Insurance Commissioner put out some recommendations for increasing these rates. And those recommendations went to the powers that be at the Office of Health and Human Services, and then to the governor. And the governor proposed in his budget funding those rate increases over a period of 3 years. And our organization, along with our partners in this effort, said that's not going to work. Funding it over 3 years, you're not going to attract people into these types of jobs. Not only they were homemaker and home health jobs, they were people who provide behavioral health services, people who provide children's services, across the board, health and human services. So we worked with our partners in a coalition to convince the legislature to fully fund, and they did. The legislature, in the budget that was passed, budgeted well over $100 million to fully fund these rate increases. I was just at a meeting because I'm on a advisory task force for this rate review, which will continue. So we won't continue to fall behind in rates. So every 2 years, they're going to examine rates. And those new rates should go into effect something about October 1st. And
Okay,
so we want to see.
Let's talk about, you say we're going to increase the funding. Medicaid is a state-managed program that is funded by the federal government, is it not?
No, not correct. Medicaid is a state and federal program. The federal government sets certain guidelines, policies, and regulations, but then the state itself has some leeway as to what they can say. The federal government says XYZ services are mandated, XYZ services are optional. The state can choose to do those or not.
Yep.
So it's not fully controlled at the federal level.
Okay.
And then the federal government sets match rates for the state. So what you spend, you get a match from the federal government. And that match is going to change from year to year. For most services in Rhode Island, it's probably around 56%, but it's higher for other services. So you'd have to really look at
56% comes from the state or from the federal?
from the federal government.
Okay, so they're paying
Yes.
for more than half.
Yes.
So it's just,
Yes.
all right.
That's how we usually look
Yeah,
at it. That we'll
okay.
get half from the federal government. We have a number of folks that we call dual eligible folks. So they're eligible for both Medicare and Medicaid.
Oh,
And right now, the state just had put out a request for proposals to managed care organizations because they're changing. Every few years they have to sort of go out to bid again to see who's going to control these programs. And they just allocated those awards to 2 health insurance plans, Neighborhood Health Plan and United Health Plan.
so that when we're talking about these programs have to be funded from somewhere, and I think it's great to say we have to increase the compensation of people providing these goods and services.
Right.
But then the question is, who pays? I mean, the state budget is not unlimited, and neither is the federal government is spending money as though they had it, but they're just printing it, so they can do what they want. But on the state level, when you make a decision about, okay, this service is going to receive more compensation, the money has to come from somewhere. Right now, 56 cents of it would come from the federal government.
Or more, depending on what category.
Right, okay. So here's a question for you. Maybe Diane, you can jump in on this too. The fact is, all of us who are senior citizens are hearing stories about their primary care physician is retiring, and they can't find another one. And so they end up being referred to a nurse practitioner or a physician's assistant, who the qualifications are not the same as someone with an MD after the name, let's be honest. But that's what's happening because in the doctors I've spoken to, there is not enough, the reimbursement rates are so low that they can't attract people to come into Rhode Island to become especially primary care or pediatricians, because they just don't get it. They don't. Is this a senior agenda addressing any of that concern? How are we going to go forward?
The senior agenda, I'm the policy advisor, and there was substantial pieces of legislation that were introduced this year that were trying to address that healthcare worker shortage. And some of them did pass, and we did support some of those pieces. And I also am on the board of the Care Transformation Collaborative, and that is a collaborative that has most recently really been emphasizing primary care practice and how to make sure we have quality care, that we have the workforce that's necessary. So some of the things that they did during the legislative session is to create a program called Career Ladders. So someone who may have been like in a healthcare worker capacity and could go on in an advanced way, they would provide some additional support for people to do that. There's also a lot of interest in primary care doctors and their payments. But most of their payments are not coming from the Medicaid program, which the state has some control over, in terms of setting rates. A lot of the payments are coming from commercial carriers, or some are coming from the Medicare program, which the state really doesn't have too much influence over. But we recognize certainly that is a problem. And you talked about nurse practitioners and physician assistants working in primary care practices. And The trend right now is to have a team approach to primary care, which can be very workable. Nurse practitioners really play a big role there, backed up by the primary care doctor, but they can also, in some cases, work independently. So the state is trying to address those worker issues. It has had a healthcare workforce transformation program going on for a couple of years now, looking at many of those issues, compiling data, doing all kinds of work with our academic institutions to really encourage our young people who are in the education system go into healthcare careers, because we know we have a shortage across the board. It's not just primary care, it's in a lot of other aspects of healthcare. And that's been going pretty well. You know, they've had career fairs for students, and we really need to encourage our students to get into the healthcare arena.
I'd just like to add something
Sure, absolutely.
in this.
Go ahead.
Okay, all
Please.
right. This is in regard to our October 9th conference, because this fits right into what we're talking about. We do have a healthcare crisis in the United States. People are upset. They're concerned about Social Security. Is that going to go bankrupt in 2033 or 35? Is Medicare going to be going bankrupt as well? So these are issues that are really important to especially the older people today. So our conference is going to be titled A Bridge to a Secure Future. And if you can imagine the graphics, a bridge with 3 support columns, okay? The first one is going to be Social Security. The second one is health care. The third one is housing. And we're very excited to have Senator Sheldon Whitehouse to be our keynoter for that conference. He's going to address those issues at the national level, and then we're going to have panelists that are going to address those issues at the local level. So it'll be a really good educational conference for anybody that's concerned about those issues.
You're aware, of course, and I think, I hope most of our audience is aware, that what you're referring to is the actuarial studies that said that those programs are going to become insolvent, not necessarily bankrupt. They're not going to have enough money to support, they're not getting enough in to pay out. So that's insolvency. So someone once said demographics is destiny. And right now the statistics show that childbearing age women are only having 1.8 child per childbearing woman, which is below the level of sustainability. They have to have, you know, it's not going to work. And the fact is that it's the working population that is paying for the benefits of me, and I guess you, I mean, in terms of Social Security, Medicare, Medicaid, whatever the program is, it's being really funded by the workforce today. And if that workforce keeps shrinking, you can have all the conferences you want, but somebody's going to have to deal with that.
I don't know if you've ever heard about Social Security 2100. I went to a conference that was held by Congressman John Larson from Connecticut and Gabe Amo. And Congressman Larson was talking about this program. It was a multifaceted program, but basically he was talking about how they could you know, refund Social Security, and that would be by putting Social Security. Right now, I think Social Security payments are capped at $400,000. Those that make over $400,000 don't have to pay into it, and they would raise the limit on that. He felt that by cutting back, it's too late for that. It's not going to do any good. But this is a program that you know, sounded really good, and this is one of the things we're going to bring up at a conference. So,
well,
and Senator Whitehouse has also got some legislation,
too, yes.
So he's going to talk about what the thoughts are, his thoughts and others about making sure Social Security is sustainable for future generations, so to speak.
Well, I don't think I'll be around at 2100, but you know.
No, but our children will.
Yeah.
Yeah, I know. So let's jump to a slightly different, we're over halfway through, ladies, but let me talk about this year's session of the General Assembly. There were 249 bills that passed and were sent to the governor for signature, and he vetoed only 5 of those. And one of them would have created a Nursing Home Workforce Advisory Board, the WSB as it's known, which is would have been a 13-member board that would advise the General Assembly and the Department of Labor and Training on market conditions, wages, benefits, and working conditions in the nursing home industry, and propose minimum standards for nursing home training programs and assist in ensuring compliance by employers. Now, the governor's veto message was a couple of pages long. He did send it to the Speaker and the President of the Senate. And in the veto message, he says, and I'm going to quote, "Comprehensive solutions to resolve critical nursing home emergency needs and support residents, workers, and long-term care facilities were absent from the legislation." In other words, you issued a statement, Diane, that said the senior agenda was, quote, "extremely disappointed," and called upon the legislature to override the veto. Well, as far as I know, I don't think the legislature's been called back, so it's probably pretty certain that it's dead.
Well, not necessarily.
Yeah. It's in recess. Go ahead.
It could, if it wanted to, before the convening of the 2025 session, have a veto.
Override?
Override.
As far as I know, speaking to legislatures, there's no plans.
No, I'm just saying that it's not absolutely dead. It could happen. And yes, we did support that legislation. That legislation started out not as an advisory board. And the senior agenda has a long history of promoting quality nursing home care.
Of course.
And we have been fortunate, Rhode Island, in that we have had relatively good quality nursing home care. But we have had some situations in the past that have been pretty horrendous, and we want to make sure that we continue to have good quality care. The pandemic certainly was a difficult period of time for our nursing homes and our nursing home residents. As you well know, hundreds of people, older adults in nursing homes, passed away across the country, including Rhode Island. And that's one of the reasons that there was another piece of legislation that we've supported for several years, and that's to really do a better job with providing additional funding for private rooms, because you know what the infection situation was in nursing homes. We have people in facilities that built in the 1950s or so, based on a hospital model, 2 people in a room sharing one bathroom, in some cases more than 2 people sharing one bathroom. So we really need to do a better job in terms of looking at how a nursing home's physical structure looks like. But we are concerned. There was a minimum staffing bill law that was created that is in abeyance because the workers are not there in the nursing homes. Since I've been involved in issues relating to long-term care, have consistently said that they don't receive enough money to really do the job that needs to be done in terms of staffing and everything else that they're required to do, both by federal and state law. So I felt, and the board agreed, that having an advisory board that would look at many of these issues and make sure that the workforce was properly trained and that we had adequate staffing standards was the way to go to continue to have quality care in Rhode Island.
So John Gage, who's as you know, is the president of the Rhode Island Healthcare Association, came out in support of the veto, and he said, hey, we've already got many layers of oversight. Having another board, just another board to do this, I mean, I don't think anybody would say that I certainly hope the Department of Labor and Training is not ignorant of the situation in the healthcare industry. They certainly are. But the answer seems to be, let's pay more money and we'll get more people. That doesn't necessarily follow. You might get more people. It doesn't mean you're going to attract quality candidates, does it?
And it doesn't necessarily mean that you're going to have well-trained staff. Mm-hmm. We have, and you know this, we have a high number of people living in nursing homes who have dementia, Alzheimer's, and other related dementias. And we need staff who are trained to deal with those kinds of issues. And so we're really trying hard to make sure that the staff is well trained. We have had programs to train them, but it's challenging because we need to give people time off to get the training. Some of it, yes, you could do it by Zoom and you can do it virtually, but you really do need some hands-on, particularly if you're going to try to escalate behavioral, de-escalate behavioral issues.
Sure.
So the idea of having an advisory board with input from all of the stakeholders just sounds like something that needs to be done. And it's not just the nursing home owners, and it's not just the people at the Department of Health, it's the community, the workers, people who are advocates coming together and saying, you know, we want to take a good look at that. I mean, I look at nursing home inspection reports, and I've been looking at them for a long time, over my years in long-term care. And we had a terrible tragedy in 2005. The death of a woman named Jermaine Morzilli. And after that, we did put certain laws in place to make sure something like that doesn't happen again. But we've had significant, horrendous issues. Not a lot, but we shouldn't have those kinds of issues happen. And we need to have well-paid and well-trained staff.
Having some experience.
And the legislature has put money into the budget to increase nursing home rates.
Rates of reimbursement.
Right. Part of the problem, and John Gage, I've worked with John Gage over the years, very reputable professional person. Part of the problem is they're supposed to be doing nursing home reimbursement is kind of complicated, and they're supposed to be looking at what they call cost centers periodically, and the state just didn't do that, and so they fell behind.
Well, again, it comes down to a problem of oversight, and I understand what you're saying, because a lot of these programs have these things that, one of the questions, and believe it or not, we're running out of time rapidly, many of these programs that are being called for require oversight. And my question, and not to your organization, but to politicians that come in here, who's going to do this oversight? Who's responsible? For example, let me give you an example. I think Mr. Gage supported the idea of maybe a student loan forgiveness program for LPNs, RNs, CNAs that agree to stay in Rhode Island and work at a nursing home. Well, that's fine. That's an incentive for them to do that. I guess my question is, who's going to keep track of these people? If I go to CCRI and qualify and pass my RN boards, which is possible with 2 years, and I say, yeah, okay, I'll stay here, and 6 months later I go to a hospital because I like the environment better, who's going to monitor this stuff? You know, that's the question I always have.
Right, that is a question. When you have loans and theoretically the person who's going to receive the loan makes the commitment, I'm going to work in this state for 5 years, you know, who's going to track that and make sure that that happens? But we do have some loan forgiveness programs, and that's something that the legislature was looking at this year as well.
So let's talk about another one of your priorities. You advocated for a caregiver tax credit.
Yes.
I'm very interested in that because the credit would be for those who are caring for spouses or parents who are at home, and that's good because we keep them at home. And it didn't pass, but you vowed again to bring it up. My question is, if I am a faithful spouse or a very grateful child who has the wherewithal to care with a spouse or a loved parent, why should they receive a subsidy from the government for doing that?
Well, let me say that the senior agenda for years has really been looking at the issue of we need to provide better supports for our caregivers because they really do provide the absolute bulk of caregiving in the state and in this country. And the legislation that was introduced actually has a provision that it's for people a single person whose income is less than $50,000. And we know—
Who is providing the care?
Who is providing the care.
Okay.
And we know, based on studies done, research done by the AARP, that the average caregiver is spending out of their own pocket something like $7,600. And if we look at the fact that our caregivers are providing care to their loved ones and giving them just up to $1,000 credit is such a economic benefit to them and saves the state over time, because they're keeping people out of federally or state supported institutions and assisted living, et cetera, et cetera.
So the credit would be limited to $1,000?
Yes, the legislation limited to the credit. It's not a refundable credit.
Okay, so, all right. I thought, actually, I was surprised it was that little. I mean.
Well, we had to, and the legislation was introduced, and knowing that the first time legislation gets introduced, it's not necessarily going to pass. But to get the idea across that we really need to be helping our caregivers, because they're under a lot of stress, many of our caregivers, and many of them are older people whose incomes are fixed, usually, not always, but many times they're on fixed incomes. They're trying to, spend money on their own health care needs, and they're paying for loved ones out of pocket.
I think I've heard you use the term long-term supports, or can you be more specific? When you that's kind of a general catch-all. What do we mean by providing more long-term support for these people?
I always think of, we used to use the term long-term care, and people automatically thought that was a nursing home.
Yep.
And so we started to expand that to call it long-term supports and services, because it's not just nursing homes. And in fact, federal government encourages us to use home and community-based services as often as we can. And so LTSS, long-term supports and services, does include nursing homes. But when we look at the fact that probably only 4 or 5% of older people are in nursing homes in Rhode Island, long-term supports and services includes residential care, assisted living residences. It includes home and community-based services, home care, adult daycare, which is a really nice program for people. They can bring their loved one, or the loved one can get transported to the day care center. People can go out to work and they come home in the evening. It also includes a program called Shared Living, and that's a program where I can take someone who needs care into my home, and I'll get a little bit of payment for that. I always say it includes some very low-level services like Meals on Wheels. And research in Rhode Island has showed Meals on Wheels in Rhode Island can prevent people from going to nursing homes, because if they don't have a meal and they don't have anybody to help them go out and get the food and prepare the food, that's a reason sometimes where they have to go to a higher level of care. So it's a whole array of services, and that's why we call it LTSS and not just long-term care.
Yeah. I think people have to recognize that trying to keep senior citizens at home is a more cost-effective solution than putting them into a full nursing home environment with all the costs that entails. I mean, if we can do that, that's fine. And there's some sorts of supports that are probably necessary. I guess the question is always, what's the details? The devil's always in the details. How do we do that? How do we ensure that people providing this support are receiving some form of compensation or recognition in some form for doing the work that they're doing by keeping that person out of the nursing home situation? Now, you did just say 4 or 5% of Rhode Island's seniors are in nursing homes. Did you just?
It's about that, I would say.
So we have 20% of the population is over 65. And 4 or 5% are in nursing home, and we said that about 2/3 of those are women. So we're slicing and dicing this demographic a little bit. But I know in my own situation, my mother, who's now passed away, but she was in Connecticut. And Connecticut, I found out, had a pilot program that people in assisted living, as opposed to full nursing care, in assisted living environment, they had a program that they were testing that these people often needed medication management, all right, and maybe a few other services, but they didn't need really the full nursing home environment, and they allowed them to stay in the assisted living, and the contract was with the head of nursing at that assisted living to provide medication management. And that was, again, it was a pilot program, and I fortunately got my mother into that program, and it was great until she actually reached a point where she was experiencing blackouts, and so she had to be in a different environment. But it seems that there's a reluctance to try some of these things. I don't know if the reluctance is on the state level or what, but somebody should be looking at keeping people in a lower cost solution to the problems that they're facing. Does that make sense? I mean,
no, it makes sense, and we do in assisted living in Rhode Island. We actually, in terms of payment through Medicaid, we do have 3 levels of different payments depending on the needs of the person. And our assisted livings can do medication management. We also have levels of assisted living in Rhode Island. But one of the things we know at the senior agenda is people are very worried about how they're going to afford LTSS, long-term care, long-term supports and services. I mean, private pay nursing homes are $113,000 a year. Thinking about that is difficult for people to think about. How am I going to manage that? Assisted living, private pay is $60,000 or $70,000 a year. Home care, private pay, anywhere between $34 and $40 an hour. So we do have a program in Rhode Island that really helps people with home care. And the senior agenda has been advocating for that program for a long time. We managed to get the income eligibility for that program up to 250% of the poverty level, which is huge, and there's no asset test for that. And that program provides individuals with up to 20 hours of home care or 5 days of adult daycare or a combination of that. And so that's a real benefit for families. The problem is a lot of people don't know about it. And so we try to get, that's one of the things, and Diane might want to talk about the information gap for people.
I'm sure there is. Go ahead.
I know. And I've seen this with friends, and I've actually experienced it myself with my mother. When illness strikes, and it strikes fast, you're lost. You don't know where to turn. You have a social worker in the hospital, but they give you options, but everything is coming at you all at once, and you don't know where to turn. And we get calls like this all the time on our organization phone. So I always refer them to the Point. Okay, because they're a great referral source, all right? Or 211, which is United Way, okay? But there has to be more media coverage to let everybody know exactly where you can go for these resources. I mean, one of my friends, she was in the nursing home. Her daughter was out of state, and she went on Facebook to her friends because she did not know where to go for help. So I think there really has to be more advertisement out there to let the people know what's out there for them.
Well, it's not, the problem is it's not going to sell media, it's not going to sell airtime, or it's not going to sell advertising space. I mean, the social media platforms are a godsend for something like this if you know how to use them.
Right.
Well, she didn't know where to go, but I mean, you can even put brochures in doctors' offices, right?
Yes.
And we do have, you know, I just talked about one program. Well, we do have programs that help people. But I always say, I hate it when I'm thinking money is being left on the table for these people because they're not accessing something that they might be eligible for to help them out economically. You know, transportation is a big issue, a huge issue. And so it's not exactly LTSS, but if you can't get yourself to the doctor's office.
Or to the grocery store.
Or to the grocery store. Then that's a big deal.
Yeah, absolutely.
I actually had an incident. I told you I got a call from a woman. She had to go to dialysis, and she had no transportation.
It's life or death.
Yeah. So she didn't want to use the state transportation, and so I went online. I said, I'll call you back. So I went online. I saw that a village had opened up in Warwick. So I said, I don't know if it's up and running yet. But I said,
because I'm on the steering
okay.
committee.
So I said, but call. I said, if they're not, I said, call Village Common in Providence, and they should be able to help you.
Tell the what is the village? I'm not familiar with that.
Okay, I'll give that to her because she's.
The Village Common of Rhode Island.
And we're going to run out of time, but keep going.
Okay.
Yeah, please.
The Village Common of Rhode Island is it's a nonprofit organization. It started out in about 2015 in the city of Providence by a group of people who had heard about a village, something like that, up in Beacon Hill. And what it does is it's a membership organization that recruits and trains volunteers to help people, older people usually, remain in their home.
It's a resource for people.
It's a resource. Provides transportation. The biggest support that is provided is transportation.
Yep.
And I'm on the board, and we are creating a village in Warwick.
Oh, good.
We have 7 local villages now. Our newest one just came on board. It's the Quidnick Island Village for Newport, Portsmouth, and Middletown.
And these are staffed by volunteers who really direct people to the services that are available?
We have a paid executive director and a couple of part-time people. But the volunteers are trained. They have a background check and to vet them. And they are the ones who do the transportation, friendly calls, friendly visits, errands, take somebody to the grocery store, to the hairdressers, might help with technology if my router, I don't know what to do. Very minor home stuff like, I can't change the light bulb because I can't go up on the ladder.
Yeah.
We have one help person that we help. We put their trash barrel out on the street because they can't do that. Little snow shoveling in the winter, so it's a wonderful organization.
Yeah. We probably should have them on the show at some point.
Yes, they'd love to be on the show.
Well, we'll keep you in mind.
Okay.
Because I think, as you say, there's different ways to reach out to the public, and people are not aware of some of these resources, but it's very, very important. Especially, I think all of us recognize that taking away your ability to drive is a big step. I mean, everybody dreads the idea that they're going to take away my keys. I mean, I went through that with my mother, frankly. And yet, there comes a point in time when you do become a threat to the people on the highway with you. And when that happens, then you now become more dependent on other people. And it's always a big step, I think, psychologically for people to do that. And I'm sure your experience is the same.
Right.
So
the village is sort of like neighbors helping neighbors.
Yes. And I think, as I say, there's a lot of these resources that people are just not aware of. And certainly when your organization has, you said twice a year you have an event now coming up in October.
Right.
What's the date of that?
October 9th. It's at the Crown Plaza in the ballroom. It starts at 7:30 and it goes till noontime.
Oh, 7:30 at night. I was going to say
No,
7:30 in the morning. Okay.
7:30 and breakfast.
Is it open to the public?
Oh yeah, there'll be a lot of publicity on it.
And is there? We're down to like 30 seconds, but do they have October 9th, and they go on the website that we're showing?
Yeah, we'll have information on it there, and
is there a admission fee?
Well, there's breakfast. So it's last year I think it was $35, $30 or $35, but that's a full breakfast, buffet.
Sure.
Robust breakfast.
Yes,
a robust
very
breakfast
good.
buffet.
Not just coffee and Danish.
Well, it's been and I want to just say it's been very delightful to have both of you here, and hopefully maybe we can come back because I have a lot of stuff to talk about.
I know.
No, that's all right. I mean, I'm very happy, and thank you for coming, and I want to thank our audience for watching this edition of State of the State.